Okay, so in treating onychomycosis, what can we do? We can look at it in terms of the dermatophytoma. How often do you see a nail like this? Probably every day of practice, someone comes in and they're harboring fungus under the nail. And as we know, the name of the game is to get the treatment to reach the site of the infection. And there are a number of ways of doing that, whether it's by drug or light therapy or so on. But as long as it's hidden and sandwiched on the nail bed, under the nail plate, it's a very hard to reach area. So whether you're shining light through, whether you're painting a topical on top, or trying to grow in a systemic antifungal, it can take time. And in an ideal world, what you want is something that can access all areas. And something I've always thought about is, what if you could just break down that dermatophytoma? Because topical therapies and light therapies, to a certain extent, there is some scatter, and also laser equipment to blow holes in the nails to make small holes to allow access for topical drugs. The only problem was it didn't know when to stop, and the patients also got holes. And about 4 years ago, I met a man, and this was a British inventor who, for a very small sum of money, invented this device. And this is the world's first intelligent nail drill. And it basically consists of a device unit, a handpiece, and a micro cutter, which can make holes in the nail of about 0.4 millimeters. The beauty of it, though, it knows when to stop. If you apply it to a nail, activate the drill will drill through the nail, but as soon as it gets to the underside of the nail, it will stop and withdraw. I didn't believe it, so I drilled myself a few hundred times, and it worked. I couldn't draw blood. So here we have one of the first nails I treated, positive onychomycosis, and you can see here quite extensive disease and damage to the nail. It didn't take me long to make a few holes in that nail, and it was very quick and painless. And the beauty of this device was the patient will sit there. It takes about 3 seconds to make one hole. And as you can see, all that debris that comes out, what we've discovered is that if you just brush that off, you can send that off to the lab, and it's very good source material to get your positive mycological diagnosis. You can yield it way down at the fringe and get far better results without damaging the nail too much, because as soon as you brush that off, the holes are virtually invisible to the patient and yourself, but you have to get up very close to see them, so it's almost an invisible treatment. And as yet, I haven't been able to draw any blood off any patient, and the holes are permanent, provided they don't use any lacquer or nail varnish. The holes stay there for the length of the time the nail is there, so the only way they go is when they're grown out of the nail. So quite simply, what I've been basically doing for the last couple of years is to do exactly that, and to use a topical antifungal on the nails. And what I'd like to do